Welcome. Okay, let's dive right into this. Today we're exploring an explainer based on an incredibly fascinating piece of source material from the OOTW journal covering mescaline and the neuroscience behind it. It's an amazing story, honestly, because mescaline was actually the very first psychedelic ever isolated. It quite literally opened a scientific doorway a full century before we even properly understood the brain receptors involved. It's this wild blend of ancient history and cutting-edge chemistry. There's this fantastic quote from the source material that just perfectly captures the mystery we're looking at today. Mescaline is a paradox wearing a cactus. I mean, how exactly did the oldest psychedelic known to humanity, literally the molecule that started it all, somehow become modern science's neglected stepchild? Well, let's unpack exactly what that paradox means. Section 1. The Ancient and the First. From Cave to Chemistry. The sheer scale of this history is honestly mind-bending. Get this. Roughly 5,700 years ago, archaeologists found peyote buttons in a Texas cave, and when they were tested recently, they still contained active mescaline. But the real Western scientific breakthrough didn't happen until 1897, when German pharmacologist Arthur Hefter finally isolated it. In an incredible act of dedication, he actually used methodical self-experimentation to prove that this one single alkaloid was a cause of visions. He was doing this decades before LSD even existed. Then, jumping to 1919, Ernst Betz synthesizes it in a lab, officially making it the very first psychedelic ever created from scratch. So, what exactly did they find? Mescaline is 3,4,5-trimethoxyphenylethylaline. It's a remarkably simple psychoactive alkaloid found in peyote and San Pedro cacti, but here is why this matters to the much bigger picture. This disarmingly simple chemical structure ended up becoming the ultimate template for future research. The legendary chemist Alexander Shulgin used this exact trimethoxys scaffold as his starting point for a whole family of synthetic chemistry, essentially tuning the molecule to create entirely new compounds. Section 2. A different key, the same lock, the 5-HT2A convergence. Now, what's really interesting about this, scientifically, we are looking at a massive molecular puzzle. On one hand, you've got your tryptamines. These are compounds like LSD, psilocybin, and DMT. They all share an indole ring that's borrowed directly from serotonin itself. But then you look at mescaline, and it's entirely different. It's a phenoethylamine, meaning it's structurally way closer to dopamine and amphetamine. So it's a huge paradox, right? How on earth can completely different chemical structures from totally different chemical families create such incredibly similar, profound states of mind? Well, the answer is that both of these chemical keys happen to fit the exact same lock in the human brain, the 5-H2A serotonin receptor. Because mescaline came from a totally different chemical family, but still obeyed the exact same pharmacological rule, it essentially became the missing link. It was this absolutely crucial piece of evidence that helped researchers finally prove that 5-H2A is in fact the primary psychedelic receptor. And that brings us to a huge landmark moment in 1984 by a researcher named Richard Glennon. He discovered this incredibly precise mathematical correlation, R equals 0.94. Basically, in simple terms, he proved there's a near perfect link between how tightly a drug binds to that 5-HT2A receptor and its human hallucinogenic potency. Mescaline was the vital, undeniable data point that proved this universal rule. Section 3. The 12-hour experience. Slow, strong, and sacred. When you compare the pharmacology here, you'll see a massive difference in how these compounds actually operate. Mescaline requires a huge active oral dose. We're talking 200 to 400 milligrams. To put that into perspective, that is more than 1,000 times the tiny little microgram doses required for something like LSD. And then there's the duration. It's a marathon, 10 to 12 hours, which makes it the longest lasting of the classic psychedelics. You aren't just taking a quick trip, you are basically signing a full-day lease on a completely different state of consciousness. So what exactly happens during those 10 to 12 hours? Well, back in 1928, psychologist Heinrich Kluver studied mescaline visions and categorized them into what he called form constants. People consistently reported seeing lattices and honeycombs, cobwebs, tunnels, and spirals. And here's the crazy part. These specific geometric visions behind closed eyes aren't just random hallucinations. We now understand that they are literally revealing the wiring architecture of the human visual cortex itself. The drug essentially makes the brain's own wiring briefly visible to the user. How wild is that? Now, because of its history, there's this widely held belief out there that mescaline is inherently gentler or maybe more embodied than other psychedelics. But the science actually challenges that reputation. A really rigorous 2023 head-to-head trial by Lay, Holsey, and colleagues found that at equivalent doses, the subjective quality of mescaline, LSD, and psilocybin is largely indistinguishable. So it isn't necessarily gentler, it literally just lasts longer.
Section 4. Sacred Cacti and Conservation. The Ecology of Mescaline.
We absolutely have to understand the urgent ecological stakes regarding where this molecule actually comes from. On one side, we have peyote. It is incredibly slow growing and currently classified as vulnerable due to severe overharvesting and habitat loss. Yet it's absolutely central to the cosmology of the Huicho people and the Native American church. Conversely, we have San Pedro, which is a fast-growing columnar cactus and a highly sustainable cultivated alternative. This is exactly why conservationists strongly urge anyone outside of those indigenous traditions to avoid wild peyote and look to sustainable San Pedro instead. For sure, it's a matter of ecological and cultural respect. Section 5. The Scientific Blind Spot, the Modern Medicine Rug Pull. So the crucial point is, here is the ultimate rug pull. Modern neuroscience actually has a glaring omission. There is absolutely no contemporary fMRI or PET imaging of the mescaline state in the living human brain. Literally none. Let that sink in for a second. The foundational frameworks for how we think psychedelics work, things like the entropic brain theory and the disintegration of the default mode network, they were built almost entirely on psilocybin and LSD. Mescaline, the oldest of them all, has just been left completely unobserved by modern imaging.
And the data highlights a stark contrast in modern clinical research. If you look at modern phase 2 and 3 trials, psilocybin has over 140 trials currently on record. Mescaline? 0. The modern pharmaceutical research machine has completely, totally ignored the exact molecule that started the entire field in the first place.
So where does that actually leave our clinical understanding? Well, right now, the largest modern dataset for mescaline is simply an anonymous, uncontrolled online survey of just 452 naturalistic users. Now, while users in this survey do report lasting improvements for conditions like depression, anxiety, and PTSD, retrospective, self-selected data like this can really only generate hypotheses. It just cannot clinically prove benefits in the way a modern controlled trial would. Which leaves us with a final and honestly profound question. Is this lack of study a scientific failure, or is it simply proof that a 12-hour sacred experience just cannot be boxed into a modern, scalable pharmaceutical model? It's a fascinating collision between ancient plant medicine and modern pharmaceutical capitalism. I really want you to ponder that question and think about what it means for the future of psychedelic science. Thanks so much for joining me on this explainer of the source material. Catch you next time.